President, I want to speak in support of the Blunt-Murray-Graham-Leahy amendment. This provides $1.1 billion in emergency funding to combat the Zika virus. Now, Mr. President, I'd ask that members might look at this map of the United States. It shows the Centers for Disease Control's estimate of the range of the two types of mosquito that may spread Zika. You can see it covers a very large part of the United States. It also shows that this public health emergency is not like Ebola or anything else where it's in some far-off land. It can end up in the backyard of tens of millions of Americans. I want to mention that earlier this afternoon, I voted for the Nelson Rubio Zika Supplemental. That would have provided the full $1.9 billion requested by the President months ago. It is mystifying to me that the Republican majority in the House voted to defeat that amendment, considering that Zika is spreading faster in more ways than predicted, even when the President first requested those funds. And the excuse we've heard for months, particularly from the House Republican leaders, they don't have enough information about the proposed use of the funds. We have had so many briefings. I wonder, have they attended any of them? Or if the briefings weren't enough, why don't you just pick up the phone, call the head of the CDC, or the director of the National Institute of Health, or any of the other experts who have been sounding alarm bells since last year. In a little over a year, the Zika virus has spread from Brazil to almost every country and territory in this hemisphere. There is no question it's spreading faster, it's more dangerous than was anticipated just a few months ago. As the map shows, more than half of the continental United States, including my own state of Vermont, is now projected to be within the range of Zika-carrying mosquitoes. And the virus can have devastating consequences for those become infected, especially for children. I think we need to act. There's one area where politicians should not second-guess the medical experts. It's how to respond to public health emergencies. It's nice to give speeches about public health emergencies, but let's at least include what those who are the experts, the medical experts, say. Now, that's not what the House of Representatives did. First, they don't treat the Zika crisis as an emergency, even though it's spread to 36 countries and territories in this hemisphere, and has been declared a public health emergency by the World Health Organization. In fact, the House bill that was introduced yesterday would cut the amount requested by more than 2/3. It robbed from other programs like the funds to combat Ebola, and they'd limit the availability of Zika funds the remaining 4 months of this fiscal year. You just say, well, just fight it for 4 months and then it's going to surrender and go away? Come on, this is nonsense. More than $500 million in Ebola funds have already been reprogrammed to combat Zika. The administration had to do this because Congress was dithering and wouldn't act, and it would have been irresponsible for the administration to wait any longer. When Congress failed to act as mosquitoes came north, the administration did act. But that's assuming, it's robbing Peter to pay Paul. It's a Hobson's choice. Ebola remains a deadly threat. Cases of Ebola continue to be confirmed in West Africa. We've seen how one Ebola case today can become a dozen tomorrow, 100 cases the next day. How quickly people here forget the fear that gripped this country after a single Ebola-related death in Texas 2 years ago. Now, the funds we appropriated to combat Ebola are being put to good use, especially strengthening the capacity of African countries to respond to future outbreaks of Ebola or something even worse. Respond to it in their country, respond to it before it spreads to ours or any other country. And the emergency funding in this bill includes $258 million for the Department of State and USAID to combat Zika in Latin America and the Caribbean. The funds will support efforts to control the spread of Zika, but also other insect-borne diseases, including to protect maternal health, expand public education on prevention, encourage private sector research for the development of vaccines and diagnostics. The funds will provide contribution to international organizations, including the World Health Organization and the Pan American Health Organization, to reduce the impact of the disease on infants and their families, but also to accelerate diagnosis. Funds are also included for the Department of State and USAID operations to start programs in the field and provide medical support for U.S. citizens and the State Department, USAID, and other federal government employees we have stationed overseas. We do, after all, have a responsibility to them. And if the Zika virus is not controlled in Latin America and the Caribbean, you don't have to be a scientist to know that a year from now it'll likely be worse than projected, but it's also going to be more costly to control. And if we continue to rob Ebola funds, which are being used for the purposes Congress intended, we simply shift the risk from one life-threatening disease to another. That makes no sense at all. Saying, well, we'll spend this money to stop this life-threatening disease, but not this one. Oh, this one's in the news. Okay, we'll take it from the first one and put it in the second one. And what happens? We have two life-threatening diseases instead of none. Mr. President, it's time for Republicans and Democrats, House and Senate, come together and agree that it should be doing whatever is necessary to protect the American people from dangerous, contagious diseases. You can go anywhere in this country, ask anybody, I don't care what party they belong to or no party. They'll say if the Congress could help protect us, we Americans, from dangerous, contagious diseases, why aren't they doing it? So I think it's past time to act. I urge all senators to support the Blunt, Murray, Graham, Leahy amendment. As consent, I see other senators waiting to speak. I ask consent that my full statement be made part of the record.
Without objection.
And with that, Mr. President, I yield the floor.